A recent U.S. Census Bureau and National Center for Health Statistics household survey reported that 24% of Americans showed clinically significant symptoms of a major depressive disorder, and 30% showed symptoms of generalized anxiety disorder after the onset of the COVID pandemic in the United States. Dr. Fava, did you expect this significant increase?
We did expect that the COVID-19 as a pandemic that affects so many aspects of our lives would have a significant effect on mental health.
Dr. Maurizio Fava is psychiatrist in chief, Department of Psychiatry at Massachusetts General Hospital and a professor at Harvard Medical School. He is a world leader in the field of depression. Dr. Fava has authored or co-authored more than 800 original scientific articles, and his articles have been cited more than 80,000 times in the literature. Dr. Fava, you've listed 7 key factors contributing to depression during the pandemic: trauma from widespread disease, grief over losses of life, fear of getting sick, unprecedented physical distancing, financial concerns, including unemployment and housing insecurity, loss of community, and reduced access to caregivers. Dr. Fava, you pointed out that there are many resources for people suffering from mental health conditions, including mindfulness, telepsychiatry, and other resources. I'd be very grateful if you give us your advice on coping with these key factors for the many who are suffering and who may have mental health conditions. So first, how do you deal with the trauma from worldwide pandemic disease?
Well, it's a great question. I think that uh, you know, uh, to a certain extent, it's important that we recognize that it's okay not to feel okay, because this is a pandemic. We have never experienced anything like this, such a threat to the health of our loved ones, our friends, our own health. So it's understandable that we're experiencing distress to some extent. At the same time, this is not the end of the world, meaning, people are looking very actively on vaccines. Um, and, we all hope that, a year from now, we may be able um, to have a more normal life, and not simply have a new normal, but have something closer to the life that we had before COVID-19. Um, uh, but you have to have that perspective that this is a transitory or transient state that we have to adapt to, but it's not. Won't be like this forever.
With the tremendous and unprecedented loss of life, how do you handle not being able to grieve in the traditional ways?
We often derive some comfort from, our ability to, um, uh, to deal with the grief through funeral services and gatherings of friends and families, and all these things are completely altered by COVID-19. Um, I the parent of a friend of mine passed away, and she had everybody on Zoom, having kind of a memorial, uh, kind of event that was virtual. And now that was the best thing that could possibly be done given the circumstances. But this is not normal. This is not how normally you bring food, or you visit a friend, or you try to comfort people in their grief. We can't do that at this time, and that has clearly had a significant impact on our ability to grieve people.
How do you cope with the fear of becoming sick yourself and even of passing the illness onto someone else?
I think that fundamentally we have to act responsibly. That is, we have to make sure that we protect ourselves, that we maintain physical distancing, and that we use a mask. Um, but also, we want other people to use the mask and keep that physical distancing. So, so I think that we've seen the countries that have done best in dealing with COVID-19 are the ones that have adopted very strict physical distancing and masking approaches, and the countries that have, in some ways, been very liberal and allowed people to decide whether they want it or not want, they've not done as well.
How do you deal with the gripping anxiety of not having any money, not being able to pay your rent, and having no job prospects?
It's another instance where it's okay to not to be okay when unemployment rates are so high. The economy is struggling. There are some businesses that have suffered tremendously. If you work in the restaurant business or the hotel business, all these things, entertainment, all these things have had tremendous, um, uh, kind of this COVID-19 has had a tremendous effect on these businesses, and therefore people have lost jobs or are fearing losing their jobs. But again, uh, um, this is now, this will not be in a year from now or 2 years from now. Hopefully, we'll be in a very different situation. Um, we're in an amazingly resilient country. We've rebounded from so many things, including, world wars. I think that we will rebound from this pandemic as well, but we need to help each other at a time like this.
People feel a tremendous loss of community. I was reading that some would love to just hear the whir of a copier again or a coffee machine. How do people handle the loss of community, and how do they build a new community, a community 2.0, as it were?
You have to leverage technology to build or rebuild or expand your support system. Technology, using the phone, using the video, using FaceTime, using Zoom, or Skype. Uh, you want to reach out to friends, family members. Uh, it's amazing how grateful people are when you reach out to them, because uh, everybody feels this isolation. And so you're not burdening others by reaching out to them. So I would encourage everybody to be open-minded and to reach out to friends, neighbors, virtually, or if it's a next door neighbor, uh, you can maintain the physical distancing and try to talk to them.
How do you deal with the reduced access to caregivers as hospitals, stressed to the limit, have had to delay elective surgery and many outpatient appointments?
I think it's very important that we take care of ourselves. The idea that we put on hold because of the pandemic our own care of ourselves doesn't make sense, because um, if we don't do that, we have other lethal diseases. There may be a heart attack, there may be cancer, maybe, and if we don't get the screenings and we don't get uh, the checkups, and we don't do this, and we don't check our blood pressure and so forth, um, we may be hurting ourselves. So, it's very important that we maintain contact and we continue to see our doctors. And hospitals, right now, I'm in my office. This morning, I came through, the main entrance, and everybody is a mask, and it feels very safe to be in a hospital. Um, it feels safer than going to some of the supermarkets where not everybody is wearing the mask properly, or um, I think that hospitals are very safe.
Mindfulness is so incredibly important to our overall well being. Now that COVID has impaired mindfulness, what do you advise?
Well, physical distancing in particular has made the COVID-19 pandemic challenging for people with mental health conditions. And so, as I mentioned, people are not able to leave their home for support, and they may be avoiding seeing their doctors. All these things uh, uh, can lead to impaired mindfulness, impaired ability, and increased rates of depression and anxiety. It's very important for us at times like this um, to put the oxygen mask on ourselves before we take care of others. And that means getting a good night's sleep, maintaining good nutrition, um, getting proper exercise and activity, and trying to really relax. There are terrific mindfulness apps like Evermind or Headspace that can help, for example. But I think in general, finding ways to relax and decrease the stress is very important.
Dr. Favi, you've covered a number of very important issues that raise serious concerns. However, at what point is the situation so serious that you need to reach out for professional assistance?
Fundamentally, when you see that your feelings of depression are not intermittent, they're not, you don't have a bad day and then you bounce back, but if you're consistently feeling down, if you feel tired, fatigued, without motivation, if you start having thoughts of that, life is not worth living, these are reasons to seek help, um, either by seeing a mental health specialist or talking to your doctor. But don't neglect yourself when you start seeing signs of depression. Similarly, when it comes to anxiety, some worrying, intermittent worrying can be, understandable. But if the anxiety is kind of eroding yourself, you're starting to worry excessively, catastrophizing, and always thinking of the worst possible outcome, um, and not sleeping well, and not being able to ever relax. That's when you have to look for help.
Many Americans are incredibly worried across so many of the fronts you've articulated so well. Any last key words of advice?
It's very important that we realize that it's perfectly okay not to feel okay during a pandemic that is threatening the health of uh, our loved ones, our friends, and our own lives. Um, Stress is affecting all of us in one way or another. And I think once you acknowledge the fact that you're under stress and that you have to take care of yourself and make sure that you get enough sleep and adequate nutrition and exercise, and 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 you try to find ways of relaxing and be mindful. I think that all these things will help you, uh, uh, during this difficult time. And finally, uh, uh, physical distancing doesn't mean that it's emotional distancing. We can reach out to others and try to connect with others uh, to diminish the sense of isolation that COVID-19 is bringing to us.
Thank you, Dr. Fava, for sound advice and wonderful insights into depression and anxiety during this pandemic. We'll have a separate film about the transformation of psychiatry during COVID through telepsychiatry and how you can find fast, easy access to care.